Hello, my LGBT cuties, and welcome back to another episode of A Jaded. I'm Rob Lovelace, and today we're talking about LGBTQ plus healthcare, the barriers many people still face when seeking care, and why equitable access to healthcare remains an important issue for our community. Now, healthcare is about much more than just treating illness. It also includes preventive care, mental health services, access to information, and creating environments where people feel safe, respected, and understood. While healthcare access is important for everyone, LGBTQ plus people often face unique challenges that can impact their overall well-being. Author and nurse Max Austin explains that LGBTQ plus communities continue to experience significant health disparities. From higher rates of mental health challenges to barriers in accessing quality healthcare, many LGBTQ plus people face obstacles that can negatively affect their health outcomes throughout their lives. One reason for these disparities is that many LGBTQ plus people have experienced discrimination, stigma, or misunderstanding in healthcare settings. And as a result, some delay seeking care, avoid routine checkups, or hesitate to discuss important aspects of their lives with healthcare providers. And when people don't feel comfortable accessing care, it can have long-term consequences for both physical and mental health. Now, mental health is another important part of this conversation. LGBTQ plus people are more likely to experience stress, anxiety, depression, and social isolation, often as a result of discrimination, rejection, or a lack of support systems. And while progress has been made in reducing stigma around mental health, access to affirming care remains a challenge for many people. Healthcare disparities also can affect different members of the LGBTQ plus community in different ways. For example, some factors such as race, age, income, disability, and geographic location can create additional barriers to receiving quality care. That's why advocates often emphasize the importance of healthcare systems that recognize and address the diverse experiences within the LGBTQ plus community. At the same time, there have been meaningful improvements over the years. More healthcare organizations are implementing LGBTQ plus inclusive policies, providers are receiving additional cultural competency training, and awareness of LGBTQ plus health issues continues to grow. These efforts have helped improve healthcare experiences for many people, but advocates agree there's still more work to be done. So the conversation around LGBTQ plus healthcare is especially important today as debates continue around healthcare access, public health policy, and protections for marginalized communities. Ensuring that LGBTQ plus people can access quality, affirming healthcare isn't just a matter of policy. It's a matter of dignity, safety, and overall well-being. Ultimately, everyone deserves access to healthcare providers who listen, respect their experiences, and help them make informed decisions about their health. When healthcare systems are inclusive and accessible, they don't just improve outcomes for LGBTQ plus people, they create better care for everyone. So if you want to learn more about LGBTQ plus healthcare and the ongoing efforts to improve access to affirming care, check out the podcast episode and blog post linked below. And remember, every day is all we have, so you got to make your own happiness